Coming up, a promising treatment that's really bringing hope to people who are struggling mightily with depression. We're going to get a first-hand look at how it works and how it's already changing lives.
Back now with your health, and this morning there is new hope for treating debilitating depression.
Yeah, this is potentially really exciting because there's this promising treatment that studies show could help some severe cases of depression. NBC News senior consumer investigative correspondent Vicki Nguyen joins us with more on this one. Hey, Vic, good morning.
Hey, good morning, Craig and Hoda. Good morning to everyone at home as well. You know, depression is a disease that affects millions of Americans. One study found depression rates tripled during the pandemic. But now doctors are putting a new twist on a treatment that's been around for 15 years. They say it's safe, it's non-invasive, and the results are nearly instantaneous. We spoke with two people who say it saved their lives.
For 18-year-old Chase, the headlines hit hard.
The sudden death of a college student.
Multiple young people dying by suicide.
If this can happen to Tyler, it can happen to anybody.
Including one of her role models, Stanford soccer player Katie Meyer.
We're just struggling to know, what happened and why it happened, We're just like heartbroken.
I always looked up to her when I was younger because I played soccer and I was a goalie and she was like the best goalie.
The high school senior had never experienced depression until the pandemic hit.
When did you decide, I actually think I need help?
Well, after like a couple months of just realizing I wasn't feeling like myself.
After trying medications and therapy, Chase says she kept getting worse and even had thoughts of taking her own life.
I was a little bit scared for myself.
Desperate, her mother found a new study by Stanford Dr. Nolan Williams. He was using a supercharged version of transcranial magnetic stimulation, or TMS, which uses magnets to create an electrical current to stimulate parts of the brain.
The brain learning to turn back on and stay on in brain regions that are turned off by depression.
Williams is a psychiatrist and neurologist studying the new treatment called SAINT, short for Stanford Accelerated Intelligent Neuromodulation Therapy. In traditional TMS, patients get one treatment a day, 5 days a week for 6 to 8 weeks. SAINT patients get 10 treatments a day, an hour apart for just 5 days. We were invited to watch SAINT in action with 30-year-old Sergio Gonzalez, a patient in Dr. Williams' clinical trial.
We turn the power up and down until we get the minimal amount of power necessary.
First, the technician pulses a magnet targeting the part of the brain that controls Sergio's thumb.
So he's not doing that, you are.
The magnet is inducing a current in his brain, and his brain is firing.
Then a special mapping software uses Sergio's brain MRI to pinpoint where doctors should place the magnet to stimulate his brain.
So this is the part of the brain responsible for feelings of control?
Yes.
And this is the part that will receive the treatment?
Yes, and this is the part that specifically interacts with another region that's involved in sadness. And so in each person, we find that best spot within this area, and then we turn it up.
When do the effects start to hit you?
Typically the next day is when I noticed.
Dr. Williams says during his study of the treatment, it was so effective and immediate, they had to cut it short to report the results that suicidal patients no longer had thoughts of killing themselves. With traditional TMS, about 30% of patients reported feeling better. With SAINT, it was 80%.
What did you think when you saw these kinds of positive results?
It was humbling. If we can truly shut down suicidal thinking in the ways that we've seen so far, you can imagine having one of these in every emergency room, every psychiatric hospital, every student, mental health center in the country.
Sergio says he was at rock bottom when he turned to SAINT.
It just works. Like, the symptoms are gone. It's just immediate relief.
Do you think this treatment saved your life?
Absolutely.
Chase also underwent a similar version of the treatment at a nearby clinic.
It was the weekend after that I realized the change. It was just like astounding.
What about the thoughts of self-harm and suicide? Did those go away?
Yeah, those pretty much went away.
Her twin sister Crystal says her sister returned.
I missed you so much, and then I saw you come back, and I was so excited for you because I knew that you deserved to feel like yourself.
Feeling hopeful once again, a promising new treatment already changing lives.
Well, Dr. Williams and his team are still researching the treatment, and they are hoping for FDA approval sometime this year. That would be really helpful because it would make this treatment much more widely available. It would also ensure that insurance covers it. In the meantime, though, Dr. Williams says there are study sites across the U.S. that are still recruiting participants. We put more information about all of that on today.com. Hoda, Craig, and Chanel, back to you.
I mean, I know it's in the early stages, but man, that sounds, it sounds.
To imagine you're going from contemplating suicide to feeling good. That's amazing.
Vicki,
All right.
thank you.
Thank you, Vicki.